Hey, this is Greg from Big Bay Mornings on 99.7 now, and I am here again with board-certified plastic surgeon Dr. Bay. Hello, Dr. Bay.
Hey, Greg.
I was thinking about you the other day. I was driving through your neighborhood. I was like, where is he in that coffee shop? I can find him in this coffee shop, and he can buy me some coffee.
Shout
Well,
out to Wrecking Ball.
absolutely. It's good to see you. And I wanted to start with this question. Now, it's commonly now referred to as getting Botox, right? If you get an
hmm
injectable to stop the lines and the wrinkles. However, Botox is actually a brand name.
hmm
And there are many different types of injectables that do the same thing as
Right.
Botox. So, how do we pick the right one?
So yeah, exactly right. The idea is that like Kleenex or Puffs are a type of tissue paper, and Botox has just been used. Just the way everybody says, "Oh, get me some Kleenex," is kind of that generic term, or "Get me some Coke to drink." The same thing is happening with Botox. It's just kind of that term that's become the generic form of what is actually called a neuromodulator. So, if
A
facial
what?
tissues neuromodulator,
Okay.
Neuromodulator. So if we're taking the SAT and we're talking about those analogies, we're going to be thinking of tissue paper is to Kleenex as neuromodulator is to Botox. So Botox is the
Got it.
brand. And there's other brands. Aside from Botox, there is Jeuveau, which is a newer one on the market. They go by hashtag Newtox on social media. There's Dysport and there's Xeomin, Xeomin. And these are all versions of neuromodulators. They're also just basically called botulinum toxin. It's the kind of the toxin that's made that you're not supposed to have kids. No children under 6 months are supposed to eat honey because it could have botulinum toxin in it, which could cause botulism. But if you do it the right way, you inject it in your face and it's fine. So you're essentially injecting poison in your face. But whatever product you're using, Botox, Jeuveau, Xeomin, Dysport, the idea is you inject it into the 11s here or into the forehead, the crow's feet. You can even do in the upper lip to treat a gummy smile. Or down here to help with if you have a bitchy resting face, it can help the corners of your mouth go up.
I want to keep
Um,
mine, so I'm not
that's you
changing
want
that. I'm keeping my bitch resting face.
But yeah, the way it works is you inject into those muscles in those areas, and it relaxes those muscles, and that makes those wrinkles go away that are caused by those overactive muscles. So again, the 11s, the forehead, crow's feet, upper lip, along the jawline. People sometimes think, oh, well, you can use Botox for these lines here, the parentheses lines. That doesn't work because these parentheses lines aren't caused by overactive muscles, so Botox won't work there. That's caused by loss of collagen, and that's where you would use fillers. So
And then
people
how
can
do
use
you
fillers for
how do you
those.
find the right brand for you, or do you just are they all basically the same and go with whatever's on sale?
Well, every company will tell you that they're the best for one reason or
Of
another.
course.
But what's interesting about it is, well, first off, just so you know, right off the top, is that I'm a speaker, a paid spokesperson for Xeomin. Company MERS makes Xeomin. It's a company based in Germany, but they have a North American unit here, and that's where the Xeomin comes from. But um, I kind of feel like they're all pretty much the same. I would treat all of these on my family members. I think they all have essentially the same result. The only one I don't use is Dysport, and not because there's anything wrong with the product. It's because they use a different gradation or measurement technique as far as how much you inject somebody in, and how much you inject somebody with. But Botox, Jeuveau, Xeomin, you basically can treat 20 units to this area in the forehead, 20 units to the eyes. So it's all pretty much the same. But the thing that's interesting is whenever a new company comes out, they don't necessarily just come out right and say we're better than Botox. Because you would think if like a car dealer comes out with a new car, a new model, a car company comes out with a new model, they'll say, oh, that this car is better than that Ford truck, or this Chevy truck's better than that
Yeah.
Ford truck. What I find with the neuromodulators is they just say we're the same as Botox. They
Oh.
don't necessarily say they're better. They just say we're the same because they know that's the benchmark, and they say, well, we're as good as it gets. This is we're the same as everybody else, so you can utilize us. The thing that may make a difference is that some of them have loyalty rewards programs that are different. Maybe you get more points and more freebies depending on which company you go
Oh my
with.
God, it's like everything else. It's like choosing an airline or whatever. You
Right.
choose the one where you can get the most advantages, points, maybe a sale, something from them. Okay, so
Credit
they're
cards.
Yeah, they're basically all the same. They're all safe. And of course, you can always be educated in Dr. Bay's office about these types of things. Tell them how to find you and how to book an appointment.
Yeah, you can always find us. If you're watching this, you're already probably on our website at realdrbae.com, RealdRbae, not BAY. You can watch us on social media, TikTok, Snapchat, Instagram at Real Dr. Bay. You can watch us operate, and you can actually watch us do injectables on patients that are okay with us showing them on social media. It's because it's different. When we're doing operations, the patients are covered up. You never see their face. But when you're doing injectables, the patients are a little bit more reticent to be shown on social media because you're actually injecting their face. It's kind of hard to hide their face, even though sometimes we'll try and zoom in really well or we'll put an emoji over part of their face. But you can watch us do those types of injectables with neuromodulators, i.e. Botox, Xeomin, Jeuveau, or Dysport in our office anytime on any social media. And you can check pricing on all of these injectables on realdrbae.com/pricing. And you can even purchase non-surgical services through our website. So you can actually pay for it online and come in and get the treatment and just walk out as though it was free. You didn't have to pay for it, even though you really did.
Perfect. And you can show my photos there. I'm such a big boy. I hardly even grimace when the needle goes in.
Thanks. That's good to know. Thank you.